circuit court decisions, one in the D.C. Circuit that said that the Affordable Care Act says that the people will be eligible for subsidies via the IRS as a consequence of getting health insurance purchased on exchanges established by the state, by a state, is the exact language, and how the Fourth Circuit said, well, we're going to use the logic of the Chevron case, which said the first question you have to ask is, what was the intent of Congress? And if there's a badly written law or a typographic error in a law, that becomes irrelevant. The question is, what was the intent of Congress? And this has become referred to as the Chevron standard or the Chevron doctrine, and that's basically what the Fourth Circuit used. So David Hogberg is with us. He's a senior fellow and healthcare policy analyst with the National Center for Public Policy Research. Nationalcenter.org is their website. His Twitter is @DavidHogberg, Hogberg, or @National Center. Hey, David, welcome back.
Oh, thanks for having me.
Thanks for joining us. This case is Hogberg v. Burwell in the D.C. Circuit. And, the Affordable Care Act, the subtitle of the section which contains this language that, the subsidies will be provided through to people who sign up through an exchange created by a state. The title of this section is Affordable Coverage Choices for All Americans. How could that not have been the intent of Congress?
Well, it's not clear what the intent of Congress was, as both the D.C. Circuit Court and the Fourth Circuit Court found. They could not come to any conclusive decision on what the intent of Congress was.
Then why did Congress write into the bill, the Affordable Care Act will achieve near universal coverage? That's a verbatim quote from the bill itself, from the legislation itself.
So is the fact that tax credits only apply to state exchanges, and there is no clear evidence on what Congress intended on that as well, and courts have to deal with actual evidence, not evidence that might have existed if someone had asked Congress about that issue. So both the Fourth Circuit, which did end up saying that still ended up saying that premium subsidies do apply to federal exchanges, still said, and this is a quote, "We cannot discern whether Congress intended one way or another to make the tax credits available on HHS-facilitated exchanges." And what the Chevron deference basically means isn't necessarily that you look at congressional intent. You start with whether or not the particular part of the statute is vague, and then you look at the agency's interpretation of it, in this case the IRS, and is that interpretation reasonable based on the statute? And if the court concludes that it's reasonable, then you defer to the agency.
Let me quote from Chevron. This was the opinion, the majority opinion that was written by John Paul Stevens. Mm-hmm. And here, this is what it says. This is the doctrine that the Supreme Court uses. First, always, is the question whether Congress has directly spoken to the precise question at issue. If the intent of Congress is clear, that is the end of the matter, semicolon. For the court, as well as the agency, in this case the IRS, must give effect to the unambiguously expressed intent of Congress. The Affordable Care Act is called the Affordable Care. This section is called Affordable Coverage Choices for All Americans. The word all is in there. It's unambiguous. The Affordable Care Act says as its purpose that it will achieve near universal coverage for all Americans. I'm quoting from the act. So are you really trying to suggest that when the Affordable Care Act was put together, this 1,000+ pieces of legislation, that it wasn't a typo, that it says from a state, that they put this in there knowing that it would blow the act up and knock 5 million people off their insurance a few years down the road?
No. In fact, I suspect that if you were to ask every single Democrat who voted for it whether or not they wanted... and
the Republicans who voted for it.
It was mostly Democrats.
But there were Republicans.
Okay, let's not get hung up on little tiny details, all right? I'm sure they would say, yes, the subsidies were supposed to go to both federal and state exchanges. The problem is, and as the courts in both the Fourth and the D.C. District Court pointed out, there is no compelling evidence of what their intent was. Courts have to deal with actual evidence, not on what we think the evidence might be, and there just is no evidence of their intent.
Okay, so let's assume, David Hogberg, that your assertion that when Congress passed a law called the Affordable Care Act that said that the goal of the act was to provide health care to all Americans, near universal coverage, that's not really what Congress meant, and we can't figure out what they actually meant. Let's assume that for a moment. That sentence that says, eligible for subsidies for people who are buying the insurance through an exchange created by a state could be fixed by adding two words, state or federal, right? It could be fixed by adding two words. This is something that the House of Representatives and the Senate could do this afternoon in 15 minutes. Why are Republicans refusing to fix a small error in the Affordable Care Act? Why do Republicans want to knock roughly 5.5 million people off their health insurance, or at least raise the price? I mean, the guy who was suing, Mr. Halbig, he was suing over having to pay $21 a year for his health insurance because he earns $20,000 a year in West Virginia.
Well, what is the question here? You're kind of
why are Republicans not saying, okay, we found a problem with Obamacare and we want to make this work better for people, and so we're going to add these two words to the law, and we're going to pass it out of the House of Representatives, and we're going to send it over to the Senate. This is going to be completely bipartisan, Republicans and Democrats both, much like Medicare Part D was under George W. Bush.
Well, I can't speak specifically to Republicans' motivations, but I tell you why I wouldn't do it, and that is that it basically amounts to putting a couple of Band-Aids on the gash in the Titanic. I mean, the exchanges are poor insurance where people have faced higher premiums than they were previously paying, higher out-of-pocket costs.
70% of Republicans are happy with Obamacare.
They don't have their doctors in their networks, and eventually this is going to lead to a death spiral where premiums are very, very high, and I suspect that anyone who makes over 400% of the federal poverty threshold will simply drop out because the premiums are going to be too high, and you're going to create this new class.
David, nobody's buying that stuff anymore. I mean, all that scaremongering is what got rolled out during the 2012 election. Nobody's buying it anymore. 70% of Republicans are happy with the Obamacare they have. Healthcare costs are rising at the lowest rate they've risen since the 50s. Things are under control. Millions of people are insured, and they're very happy with it.
They're not happy with it. There's plenty of no.
Look at the Pew poll that was just done.
Recently,
70% of Republicans.
No, where is that coming from? Where is that particular piece?
I believe it was Pew. It was one of these, reputable, non-affiliated polling groups.
Well, the Kaiser Family Foundation found that there were a lot of people with their new insurance who were especially the people who had to switch, who were unhappy with it. And no, I mean, the slowdown in healthcare costs started long before Obamacare, and we're beginning to see from GDP numbers that it's beginning to pick up. I mean, the New York Times admitted the other day.
So what's your solution,
the other day,
David?
That if you're going to increase coverage this much, costs are going to rise.
What's your solution?
A free market solution.
In other words, say to everybody, you're on your own. If you're rich, great. If you're poor, you're screwed.
That's just a leftist distortion of what the free market actually is. Sorry. But nice try, though.
All right. Well, I got to try. David Hogberg, Senior Fellow and Healthcare Policy Analyst at the National Center for Public Policy Research, nationalcenter.org. Thank you, David.
Thank you.
Good talking with you.